Welcome back to Senior Savvy Cannabis. I'm Katherine Goldberg. Today, we're joined by Dr. Michelle Weiner out of Miami. Dr. Weiner is a pain specialist. So before we jump into cannabis specifically, can you just tell me about your pain philosophy? Why are so many people in pain and why are doctors not really like figuring it out?
Well, I think that's a great question. I think I treat chronic pain patients all the time, and I really think that pain is biopsychosocial. And what that means is that yes, some pain is related to your genetics and physically what's going on in the body and the physiology and biology. But then there's this other component, the psychosocial component, which has to do with how you perceive pain, how you cope with pain, what your lifestyle can include, like let's say your sleep is not well or your social environment causes you a lot of stress. So I think the nervous system is one system that we can interpret signals wrong based on how much stress we're going through, and therefore other things can affect our overall pain. So I think we have a chronic pain epidemic right now because we've been treating pain from a very biomedical standpoint where medications and injections are what we use. And now we realize that most chronic pain is actually processed in the brain, and we need to actually go a little bit deeper to try to figure out the psychosocial components that could be amplifying one's pain and not just allowing patients to rely on medication where they basically numb themselves or don't feel things. And it's better to actually get them to feel and be more aligned mind, body, and spirit. So I think we've been treating pain wrong, and now we've created this epidemic. And the goal is really to get people to understand that pain is an unpleasant sensory experience without or with tissue damage.
Really great answer. I did cognitive behavioral therapy many years ago and really found that that was a great match because I wasn't trying to change anything. I was just learning how to reframe my experience. Is is there any sort of like cognitive behavioral therapy specific for pain?
That's a great question. So it's called pain reprocessing therapy. It was created by a guy named Alan Gordon. And what we do is we have the person track different sensations in the body, and we teach them tools to basically calm their nervous system down. A lot of it is mindfulness techniques and getting them in touch with their body. So we have to get them out of their thoughts, out of their beliefs that may limit them, and really do more embodied somatic work, which is having them connected to their body. I think pain reprocessing therapy should be a first line treatment for most people who have pain before we jump to medications, because then we're basically, asking something outside of us to fix us when really nothing may be broken. It's just really about reprocessing the sensations. And we don't really call it pain, we call it a sensation,
Hmm.
usually with an unpleasant emotion, which is most of the time fear. People really have fear that amplifies the pain signals.
Great answer. And I promise we're going to get into cannabis.
Okay.
I just feel like cannabis is it's one tool in the toolkit, but you can't ignore all these other tools that could be very helpful. And also, by the way, cannabis was the bridge that I needed to be open-minded enough to approach cognitive behavioral therapy. So, can you tell us a little bit because you do recommend cannabis for some patients?
Yeah, well, and that's actually a good point because I actually use something called ketamine assisted therapy. And I got into that because I realized that cannabis can alter one's consciousness. And when someone has an alteration in their consciousness, it allows them to perceive their world differently. So I think cannabis can be a crutch for many people when they're going through a difficult time, but it's really a medicine that we can personalize and allow them to use in a way that's unique to their body.
Do you work with people of all ages? Do you work with seniors?
Yeah, so I seniors are like my favorite population. The way I got into cannabis was I started to do research using cannabis for chronic pain in the senior population. We
Hmm.
actually got a grant to study that. And the reason is because seniors, first of all, have multiple medical diagnoses, so they're on many medications. And the problem with this polypharmacy is that there's a lot of side effects. They get dizzy, they may fall, their liver has to metabolize all these different medications. So the reason I loved cannabis for seniors was because it was one medication that if I taught them how to use it, they can use it in all different ways for many different conditions, and then we can help to reduce their overall medications. Also, seniors have a lot of chronic pain due to arthritis, degenerative disc disease, all those type of things. So we were able to use cannabis to help them reduce their pain medication, especially their opioids, and help them sleep better, their mood improve. So it's nice because once you learn how to use cannabis and how it affects you, you can really use it for many different things along the way.
I just moved to Miami and I'm waiting on getting my medical card. I applied, I'm in that 10-day waiting period, which is fine. In California, we were able to shop by like minor cannabinoids.
Mm.
There were a lot of products like CBG is really hot right now, like especially for people with like stomach issues or migraines. Um, does the is the Florida market obsessed with high THC the same way it is everywhere else? Or do
Mm.
they seem to have some medicinal
Yeah,
offerings?
unfortunately, it's pretty sad
I
because
get it.
yeah, because what ends up happening is there's maybe 3 dispensaries out of, I think we have 28 operation. We have 20, maybe 21 licensed dispensaries right now in Florida. So we have all these different dispensaries. They have many different stores, and most of them sell high THC, a little bit of CBD, which is way too expensive, sold at the dispensary. And then some have some CBN. CBN, we know to maybe help with sleep a little bit with pain, but usually the dose that they're giving in their edibles for CBN may not even be that effective. So unfortunately, CBG is something that we hear a lot about for many different things, GI, anxiety, and we don't have access to that right now, which is sad. But Florida, we've had our program for 8 years now, and we really have a market that has so much focus on high THC, which is unfortunate. But we do have a lot of other dispensaries that still give like 1-to-1 ratios of CBD to THC. There's certain dispensaries that have 4-to-1 ratios, higher CBD to THC, or let's say a 1-to-9, where you have low CBD, high THC for sleep. So you can still get some ratios, but like I had a patient the other day who I'm seeing for chronic pain. I told her to get a 1-to-1 tincture. She bought the tincture, but it was irritating her throat. So then
Mhm.
she went back to the dispensary, and it was over the weekend. And I talked to her on Monday. They told her to purchase a capsule instead, but the capsule was 25 milligrams of THC. And she's like a 75-year-old woman.
Oh
She
my
had
God.
a horrible weekend. I'm like, why didn't you call me? She's like, I didn't want to bother you. And of course, this is the problem with lack of education. Even though I educated her, she still went to the dispensary, bought a product that was way too high for her, and now of course she doesn't want to use cannabis again, and now I have to try to like re-educate her. So there's always like that ramp up of like trying to become educated and understanding how it affects you, but then you're still at the mercy of these bud tenders, let's say.
Right. Who don't necessarily have the background and training in science to point people in the right direction.
And also, they don't have the connection with the patient. They're not really understanding who they're talking to. This is an older woman who's cannabis naive, but he thought, oh, she has pain. She needs a capsule. I'll sell her the only one we have, which is 25 milligrams. Of
Right.
course, I told her you could buy a 1-to-1 edible and maybe take half of that and start with 5 milligrams and see how that feels. So, there's ways around it. And I love cannabis because it's flexible, it's personalized. We can use it for people who have no experience with it and start low and go slow and understand how it affects them. But the problem is when they use a product that causes a negative side effect, they obviously get turned off very quickly.
And we hear that everyone has an edible horror story. And it's
Right.
unfortunate because it can really help some people. Um, are some of the seniors still like, do they think this is taboo?
There, yeah, and it's not just seniors. I think even younger people
Mm.
really are. They think based on the stigma. They'll say like, "Is this going to affect my license if I'm a
Mhm.
lawyer or a doctor, or is this
Wow.
is it a HIPAA compliant registry? Can people look me up?" People have that issue, but then they're also hesitant because there's not enough evidence. And I think the problem with the evidence, of course, is that it's difficult to make, double blind randomized controlled studies with cannabis, obviously, because you sometimes know whether you have it or not. And also, we were using NIDA's 4% THC flower to do most of the research, which is not the same cannabis that we use in our dispensaries. And I also think everyone's endocannabinoid system is different. So now someone may have the same diagnosis, but the THC may affect them very differently. And others may have never tried cannabis before. And I think if you really have a negative stigma about it, you have to address the stigma before you start ingesting cannabis. Otherwise, your mind will tell you this is not a good thing for you. I really do believe in that. So I think most of it, the consultation is education and understanding where to start and how to increase it over time based on how someone's doing. And education's number one when it comes to cannabis or any type of plant medicine.
Absolutely. And so when I applied to get my card, I talked to the very nice doctor for like 4.5 minutes. And I'm probably not going to talk to this doctor again. Do some of your patients continue to have a relationship with you as they want to work on their pain? Because it seems like this is kind of an ongoing
Yes, of course.
situation.
Like this morning, I had a follow-up patient who has low back pain. And as I'm talking to her, I'm like, well, you also probably would benefit from physical therapy. So of course I can also help her with physical therapy. So usually my patients are patients that I see in a very integrative, holistic way, where I'm actually trying to understand who they are, what their goals are, what their lifestyle habits may be. It's about the relationship, I think. I'm not just a cannabis doctor. Really, I'm here to try to help them. It's a whole process, I think. I think cannabis is just one medicine and one tool that we can use. But I think it also gives the patient the ability to dose themselves, assuming they understand how to use this medicine. And I like that, because I think a lot of what's happening in medicine now is people are wanting to go to the doctor less. They're doing their research online, they're injecting themselves with peptides. There's all these different things that are not even FDA approved that the patients are using because they're sick of taking a daily dose of a medicine that's not really getting to the root of their problem. So I think we call it the therapeutic alliance, the relationship you have with the patient and how well you're able to connect with them. And I think that's important, especially for something like cannabis, that it's not FDA approved. And I'm trying to help them understand that this is lab tested, what's in the product, it's safe. Don't buy this at a gas station or a vape shop, the difference between Delta 8, Delta 9, all of those type of things.
Excellent. And I think you're right. I mean, it really comes back to the brain and going from there. I'll just end on this question. I recently got a function test just because I thought it would be fun. And I learned that I was deficient in various things that might have been contributing to like my anxiety or depression or low energy, whatever. Could it possibly be that some people who are suffering in chronic pain, besides having the tissue damage and besides having maybe the wrong conversation in their head about the pain, are there any things that people in chronic pain are deficient in across the board that might like amplify the pain more than with someone else who had enough of that, whatever level it is? Does that make sense? I know it's a weird question.
No, you're trying to say, are there any biomarkers we can test in your blood that can tell us that you may be predisposed to chronic pain, or your pain may get worse based on these labs? That's
Exactly.
That's really in research right now. There's a big lab in Stanford that's actually studying that, because what we want to do is understand who develops chronic pain. Why would your acute pain heal, and why would someone else's acute pain turn into chronic pain? And a lot of that has to do with something I call central sensitization, which is when your nervous system is very reactive to different things. You could have had a big trauma, never healed from that. You could have an infection that's kind of dormant in the body. So there's many reasons that could predispose you to that. There's also something called the clinical endocannabinoid deficiency syndrome, which is when you don't make enough anandamide or your endogenous cannabinoids. You have symptoms related to things like fibromyalgia, chronic migraines, chronic fatigue, IBS. So I think that it's difficult to study the endocannabinoids, but I think that's something that we're looking to see in the future. It's just that things turn over very quickly. I do think that finding biomarkers to understand who's more predisposed to chronic pain would be helpful. But I also think that there's an overlap with mental health and, PTSD, anxiety, depression, that may change the way someone perceives pain. So I think it's really redefining pain and not looking at pain like the problems in the physical body. But when it's chronic, it's more related to what's going on in the brain. And therefore, things can be reprocessed with more coaching and therapy. We even do cannabis assisted coaching. So that's if we give you a low dose of cannabis and we talk a little bit, how do you feel in your body? Things that can maybe calm that alarm down that's going off, that's making you perceive the world from a lens of danger. So I think there's ways of using these substances that can help to treat the root cause of someone's problem, as opposed to, again, just kind of numbing them.
Brilliant, brilliant. Thank you so much for your work. I know you're helping so many people. You're like a rock star in Miami. I've only been back a week, and like 12 people have told me how fabulous you are. So
Thank you.
hopefully this is just the first of many conversations about pain. Because even though I focus on cannabis, I'd like to take a step back and understand the entire landscape, because people just want results, and not everyone gets results from cannabis, and we need to be flexible with that.
And I
Um,
totally agree. Honestly, I think that I am a big advocate, and I like personalized plant medicine. And at the same time, it's not for everyone. And I do believe that people start to use it and they overuse it. And then there is cannabis use disorder, or maybe it's making someone's anxiety or depression worse. And so there are definite risks. But at the same time, I think it's a harm reduction method that can help reduce things that may be more toxic to someone. And again, I think it's about having the person have a little bit more autonomy and being able to feel their body and not just rely on things outside of them to treat them and heal them.
I love it. Well, thank you for helping so many people. And can our listeners look up your clinic?
Yeah. So my clinic's called NeuroPain Health. We're in Deerfield, Hollywood, and Miami. And the initial cannabis consultation has to be in person, and then it's every 7 months after that, virtually.
Okay. And if someone wanted to work with you one on one for pain coaching, is that something you offer?
Yeah, I offer pain reprocessing therapy, ketamine assisted therapy for both chronic pain and mental health, regular pain management. So, a whole bunch of things. And I have a great team of coaches, nurses. I think the team approach, that multidisciplinary approach, is really important to help someone heal.
Awesome. Well, thank you so much.
Thank you for having me.
Okay, that was so good. Awesome. Thank you so much.
Sure, that was like the
Oh,
easiest